So good morning, everyone, and thank you very much for joining us for day 3 of the THET conference. We've had a wonderful array of speakers so far from 28 countries. We've had people speaking from 105 organizations. People have come to attend the conference, so it's really great. And of course, remember, you can engage live, but you can also go back in and watch particular sessions because they're all recorded. So I'm very, very pleased to welcome you to day 3. In some ways, last week was very challenging, particularly Friday, and the focus on insights from an unequal world. But I don't know whether you agree. I felt it was really important that we look at the problems, that we lean into the challenges of racism, of inequality, of vaccine inequality, before going on to gush and enthuse about the difference we can make. And so I found those sessions, particularly on the Friday, really helpful. Today we shift gear and we focus firmly on expressing our hopes in relation to the International Year of the Health and Social Care Worker. We have 2 fantastic breakouts following this plenary session that will focus on exploring the role of the UK government, and the other one will explore what we mean by solidarity in this International Year of the Health and Social Care Worker. My colleague Lisa will then chair a session at the end of the morning, which will be focused on well-being. And we'll have closing remarks from Professor Jed Byrne of Health Education England. But we start this morning with a keynote speech from Elizabeth Iro. And Elizabeth, I want to thank you for joining us very much. Elizabeth is the first senior appointment at the World Health Organization as a nurse, and is inspirational for that reason. And your attendance here is really our chance also to celebrate what you've achieved, and also to express our solidarity with you around the importance of nursing. I just feel that you, with the Help of Nursing Now campaign and others, have really transformed the status of nursing, and how appropriate that is, given the challenges nurses have leaned into over the last year. So thank you. Without further ado, I'll hand over to Elizabeth.
Thank you very much, Ben. Good morning, colleagues. Being nurses and midwives stand for a safer world. It is many hope for a world where women are equal, a world where people can get the healthcare that they need when they need it from people who are trained to deliver it, a world where people can get a decent job without the fear of discrimination, violence, sexual assault, and abuse, a world where vaccines are available to all who want them. Safety in our communities is about equity, access, and education. Last month, only 14 of the 54 African countries met the global target to vaccinate more than 10% of their populations by the end of September. Last year, the 200th anniversary of Florence Nightingale's birth, the World Health Organization shone a light on the work of nurses and midwives worldwide by designating 2020 as the International Year of the Nurse and the Midwife, further amplifying the visibility of the work of nurses and messages from the Nursing Now campaign. The State of the World's Nursing 2020 report, published in April that year, highlighted the global issues facing the profession, inequities in the distribution of nurses around the world, a need to accelerate nursing education in order to respond to changing technologies and advancing models of integrated health and social care, a requirement to create 6 million new nursing jobs by 2030, and the promotion of leadership so that nurses can competently play an influential role in health policy formulation and decision-making. In the thick of the pandemic, the World Health Organization continued to highlight the diverse work delivered by all those who provide care in our communities by designating 2021 the International Year of the Health and Care Workers. The majority of the world's health workers, almost 70%, are women. About 28 million of them are nurses and midwives. The pandemic illuminated the work of health and care workers on a global stage like never before. Nurses and midwives have played a central role during the COVID-19 pandemic in the complex work of our professions in the areas of public health. Emergency care and vaccination has been more prominent and visible to all, but it has come at a devastating cost, with an estimated over 100,000 health and care worker deaths. Now, a shortfall of about 6 million nurses and midwives has been exacerbated by the COVID-19 pandemic, with 66% of countries reporting health workforce shortages as the primary cause of disruption to essential health services. We did not appreciate the impact that the pandemic would have on the mental health of our workforces and its impact on an already under-resourced nursing and midwifery workforce has left the profession vulnerable and fragile. Retention of the current nurses and midwives is a major challenge, as is their recruitment. Countries were challenged to keep their health workforce safe and did not have resilient health systems to cope with prolonged crisis. In May this year, Member States endorsed a resolution and the Global Strategic Direction for Nursing and Midwifery at the 74th World Health Assembly to strengthen both nursing and midwifery with 12 policy priorities to scale up education, to address the global shortage, to create jobs, build leadership capacity, and expand service delivery. As trusted members of our communities, nurses and midwives are ideally placed to lead programs of improvement and change that will address the issues that affect the health of our nations and threaten our commitment to achieving the Triple Billion Targets, Sustainable Development Goals, and universal health coverage by 2030. Our successful progress to achieving these ambitious goals now depends on countries and partners' investment in our health workforce within the context of a world that faces poorer health as a result of inaccessible health services, lack of clean water, and absence of clean and sustainable energy resources. It will require reforms in the system for training and education of nurses and midwives and support the opportunities that technological advances offer for safer and integrated patient-centered care. From the State of the World's Nursing Report, we know that the presence of government chief nursing officers and national nursing leadership programs are associated with a stronger regulatory environment, a more educated and better governed workforce, and safer patient care. As nurses, we have been exposed and affected by the consequences of inadequate planning. And as nursing leaders, we must contribute to the strategies that ensure we are never in this situation again. Our workforce is fragile, but as we move forward, we have learned the importance of having senior nursing leaders at the tables where decisions around strategy and planning are made. Health workforce are critical components of health systems, and nurses and midwives must be involved in the decision around how they are designed and managed. We need to work alongside our partners and others, economists, lawyers, environmentalists, and politicians, if we want them to hear what we have to say. We have to understand the world that they work in, the language they speak, so that we sit at the table as equal partners with a unified goal. We have lessons to learn, and from these lessons, we can create opportunities to strengthen our workforce. Strategic Direction for Nursing and Midwifery offers governments a roadmap to move forward with strategies that ensure nursing and midwifery careers are not only attractive to young people considering their work options, but they prioritize safe work environments, access to education, training, and fair pay. It is these factors that will make people join our profession, and most importantly, it is these factors that will keep the nurses and midwives in the jobs that they are in today. We cannot afford to lose our workforce. Our commitments cannot afford, our communities cannot afford to face a future without the workforce to look after them when they are ill. But if we fail to act, if we fail to prepare for the future, if we fail to address the critical issues we face in nursing and midwifery today, we will fail the very people we rely on to keep our communities healthy. We cannot support our sick and vulnerable populations or keep them safe if we ourselves are unprotected. Our health and care workers cannot provide high quality and compassionate care if they are emotionally and psychologically fragile. We cannot do this work alone. Throughout the pandemic, we heard stories of bravery and courage, of individuals who performed heroic tasks to support their communities and who sacrificed a great deal to care for others. But far more frequently, we heard how communities came together, how health professionals at every level joined forces to work in different ways, and we saw the effects of multidisciplinary and partnership working, the immense power of partnership. As we plan our complex work around implementation of the strategic directions for nursing and midwifery, we will endeavour to build strong relationships with government chief nurses and midwives, ministries of health, and our key partners, the International Council of Nurses, the International Confederation of Midwives, the Nursing Now Challenge, and our collaborating centres around the world, and institutional health partnerships such as SAT, all who bring expertise, experience, knowledge, leadership, inspiration, and hope to some of the biggest challenges that our profession has ever had to face. Between us, we can collect and use the data. The data gives us the evidence and information we need to make policy, and then to have those policy dialogues. Dialogue leads to decisions. We cannot solve these challenges without the strong and effective partnerships where we can make wise decisions based on evidence and context. My overwhelming hope when we emerge from this pandemic is that we will build and strengthen our health and care workforce by working together, by recognizing that our successes are not defined by our individual skills and professional capability, but how we combine our knowledge and work with one another at every level to create better health for all. Thank you.
Thank you so much, Elizabeth. I've said this before, but you'll realize that virtual conferences, you don't get any applause. Instead, you get these wonderful emojis floating up from the bottom of the screen. So I hope you realize how welcome your words are, and particularly your encouragement of solidarity in this year of the International Health and Social Care Worker. Thank you so much. I'm hoping you'll be able to stay a little bit longer, so that if there is time for questions later, we can ask those. But I will keep going through the session, if I may now, and offer a very warm welcome to Dr. Tadesse, who's the Minister of Health in Ethiopia. Anyone who knows THET will know how important our relationship with Ethiopia is, and it flows from a long-standing relationship that our founder, Professor Sir Elger Parry, had and continues to have with Ethiopia. So it's a great pleasure to have Dr. Tadesse address this conference.
Excellencies, honorable delegates, Ben Sims, CEO of TET, ladies and gentlemen, on behalf of the government of Ethiopia and my ministry, it's a great pleasure to provide a few remarks on the TET annual conference, and particularly on this session focusing on the important topic of health and social care workers. It is indeed very fitting we are addressing this topic, considering the challenges faced globally and the year declared as the International Year of Health and Social Care Worker by WHO. I would also like to thank the conference organizers of TET. I've had the pleasure of meeting your Chair of Trustees, Judith Ellis, when she visited Addis Ababa a couple of years ago, and also know that the founder, Professor Sir Elger Parry, is a long-standing friend of Ethiopia and to many senior faculty of Ethiopian medical schools. I thank you for the work you're doing in partnership with my ministry and to improve the lives of patients with non-communicable diseases in particular. The latest challenge that the globe has faced has transformed the world into a small village. The COVID-19 pandemic has been devastating, and health and care workers have been at the center of this storm. This conference reminds us of the vital importance of collaboration across borders. COVID-19 pandemic has claimed the lives of over 4 million people and affected nearly 223 million people. In Ethiopia, nearly 318,000 people are affected, and the days toll closing towards 6,000 people. Despite the challenge, COVID-19 was also an opportunity for us in Ethiopia, and I believe for us all globally, to evaluate the preparedness of our facilities, critical care units in general in our country, and also work towards strengthening these systems. Our vaccination campaign began in March this year through the COVAX facility support, whereby 2.2 million vaccine doses were made available in the initial phase. This focused on healthcare providers, elderlies with comorbidities, and other high-risk groups. Going forward, this has expanded to vaccination of more groups, with more vaccines being made available by our partners and friends globally. But as we know, we are a big country with over 100 million people, So while countries like the UK may have enjoyed the vaccination coverage of more than 80%, our level of vaccination coverage is just approaching 3% only, as we have now vaccinated a little over 2.9 million people. I have been asked to express my hopes for this International Year of Health and Care Worker. My first hope is that we will all work together in solidarity to champion equal access to vaccines for every individual in the world. Otherwise, as we all say, no one is safe until we are all safe. The TED conference theme is Power of Partnerships, Solidarity in the Shadow of COVID-19. I sometimes feel that health and care workers are rather better at delivering solidarity than many of us. And indeed, solidarity is what we need in this International Year of Health and Social Care Worker, between individuals, between nations, between governments. The COVID-19 pandemic has arrived in Ethiopia while we are still fighting our long-standing challenge: communicable diseases, the continuing maternal and child health problems, and the new emerging crisis for the past several years, which is the rising of non-communicable diseases. In Ethiopia, almost 300,000 premature deaths a year are due to chronic diseases like diabetes, respiratory and heart conditions, and over 4 in 10 Ethiopians will die due to NCDs. And by 2040, NCDs are projected to cause almost 70% of Ethiopia's disease burden, which is quite starting from the 17% we had in 1990. NCDs are a particular concern also in Ethiopia's rural areas, as rural patients, many of them very poor, face long journeys to health facilities in difficult conditions and at high cost. They need to access NCD services closer to their homes, and hence this is why we are working as a government of Ethiopia in scaling up NCD decentralization to primary health care units, following the adoption of our national strategy in 2014. And for this, we also acknowledge the support which TED has provided. More recently, I also applaud the work TED has done together with Novartis Social Business to train health workers in the diagnosis and provision of care for people with hypertension and diabetes. Over 200 primary health facilities have been reached through your efforts in the past 2 years. In Ethiopia, TED has been here for a long time, starting with helping medical schools in Gondar and Jimma universities. These universities at the time had only few and young staff which are at constant risk of turnover. And with the links that were made with UK universities through the support of TED, this has helped retain staff and engage them in research and in short subspecialty trainings, and providing scholarship on a 90-day course on tropical medicine at the London School of Tropical Medicine. So my second hope for this International Year of Health and Social Care Worker is that these kinds of partnerships continue. The Ethiopian government and my ministry in particular appreciate the long-standing partnership with the government of UK. And we are admirers of your National Health Service, while recognizing, of course, that there are substantial differences between the two countries. So it was therefore a particular concern that we recently experienced cuts in the allocation of UK aid to Ethiopia, which we also know it had happened globally. But UK partnerships have been and are still one of the great supports for our health system strengthening program in our country. Much work has been done in planning this program, and I express my hope that such funding programs will continue into the future as a channel for sharing expertise and specialist knowledge, which are very valuable to us. I began my speech by talking about the grave challenge facing the world, and this, we all know, will remain, at least for a while. So my third and final hope for this International Year of the Health and Social Care Worker, therefore, has to be that the contribution of our health and care workers are made recognized, not just today, not just in the storm of the pandemic, but it continues tomorrow when the headlines may be moved on. So let us never forget what we have learned about the debt we owe to our health workers over the past 2 years. I thank you all.
Thank you so much, Dr. Tadesse. A speech that I personally will re-watch again and again. The opening statistic about the levels of vaccine coverage being almost 3%, but only 3% in Ethiopia versus over 80% in the UK, send a really powerful reminder, probably one that this audience doesn't need, but it's still staggering, isn't it, to hear the degree of inequity in terms of access to vaccinations. We also note the reference to the loss of UK aid funding. There was an element of embarrassment, and we've communicated this to Dr. Tadesse, that we had taken so much of her time to prepare a program that was then cancelled. But thank you for that core message of hope that was in your speech, which was about the continued need for the exchange of expertise and the continued need for solidarity and the recognition of health and social care workers being at the center of that. We now shift gear and we have 3 presentations, one from each continent, well, 3 presentations from 3 continents, from health care workers themselves, giving insights into their experiences of this last period and their hopes in this International Year of the Health and Social Care Worker. So it's a great pleasure to introduce Dr. Cornelius Dodu, who is well known to many. I think I mispronounced your name, judging from your reaction, Cornelius. I should have checked in advance. Sorry.
That's all right.
A pharmacist, a lecturer, very involved in our Commonwealth Partnerships for Antimicrobial Stewardship work from Ghana, and who will now shame me by pronouncing his name correctly. Thank you, Cornelius.
Thank you very much, Ben. All right, so I'm Cornelius Dodu, a pharmacist and a lecturer with the University of Health and Allied Sciences. Let me just try and share my screen. Just a minute, I think it's perfect. Yes, so I'm going to be presenting on hope in the International Year of the Health and Social Care Worker. The outline for my session is I'll give a brief background to myself and what we do here, some challenges we have encountered over the past couple of years, my message of hope, and then what I call a call to action. So with a brief background, yes, aside being a pharmacist and then a lecturer, I've been actively involved in health partnerships since 2019. And our health partnership involves University College London Hospitals, NHS Trust, University of Health and Allied Sciences, that is my university, and then the Whole Teaching Hospital, that is a teaching hospital affiliated to our university. And our partnership came up as a result of the Commonwealth Partnership for Antimicrobial Stewardship. So our main focus is trying to address issues around antimicrobial stewardship and resistance. And over the past years, we've been working to enhance health and care workers' roles to support delivery of antimicrobial stewardship programs. As a result of our projects, we've led to an improvement in the knowledge, awareness, and practices surrounding antimicrobial stewardship. Activities have resulted in an improvement in documentation of antimicrobial use locally. And one other aspect we are very proud of is the fact that we trained staff on introductory sign language skills, mainly because we feel that no one should be left out. So when clients who have got hearing and speech impairments come to the facility, they need to be attended to completely to ensure, total and holistic care. Activities around COVID-19, as fate would have it, we had planned somewhere 2018, 2019 to train staff on infection prevention and control. This was scheduled to happen in January 2020. It did come on, and 2 months down the line, we had our first case of COVID-19. And when, it became very epidemic in the country, the training we had given to our healthcare workers came in very handy. Also, during the heat of the pandemic, when hand sanitizers were in high demand, we had members of our partnership producing hand sanitizers for local use. With a picture of COVID in the country, I put this together yesterday, so pardon me if the information has changed this morning. But at the moment in the country, we have 2,696 active COVID-19 cases, clearly indicating that we are not out of the woods yet. With regards to our vaccination updates, to date, well, this information is as of 4th October 2021. We've had 2,025,183 total vaccines being administered, of which 820,037 people within the country have been fully vaccinated, and we've got a population of about 30.8 million. And with just 820,037 people being fully vaccinated, we are somewhere just about 3%. We still have a long way to go. So with our challenges, mainly, as I indicated in the previous slide, we've been pretty much hit by the inequities in availability of COVID-19 vaccines, which is a challenge globally. A bit more local, we've got a not so good ratio of health professional to the population. Information available as of 2017 indicated that we have about 1 physician per 10,000 individuals in the country, and it's the same scenario that is painted for the other cadres of healthcare workers. So there is a lot of staff stress and workload on the healthcare professionals. We've got quite some infrastructural challenges as well, both physical, medical, and non-medical challenges, and there's a lot more room for improvement. The other challenge which affects me so much in the kind of research I do is availability of funding. There is limited medical and scientific research funding available to us, which makes it difficult for us to push forward the numerous scientific ideas we have down here. But in the midst of all this, there is hope. I've titled this slide, Yes, We Can. In the heat of the pandemic, in the country, we were able to put up a 100-bed capacity hospital within 100 days. And this is the Ghana Infectious Disease Center. The picture is what you have at the top right there. This was put up to address the needs of COVID-19 during the heat of the pandemic. Also, during this period, there was lots of local manufacture of PPEs. Proud to that, we were pretty much importing most of our PPEs. And, during the pandemic, we had to get our acts together. So there was a lot of local manufacture of PPEs. I've got another picture down there where you see a gentleman by, a hand wash basin. And that is actually a contactless hand wash basin that is solar powered. So during the pandemic, there was lots of innovation. I mean, aside all the negative elements of the pandemic, there was lots of innovation also going on. And that's just one of the hand basins, or the contactless hand basins that were developed or designed during the period. Another element that gives me hope is, as a result of the pandemic, the president of the country has commissioned the Presidential Vaccine Manufacturing Committee. And the sole purpose of this committee is to present a roadmap that will lead towards the local manufacture of vaccines within the country. And very recently, an issue that gives me hope for the future is the fact that the WHO has recently approved the first malaria vaccine. But in the midst of all these, we can't just be hopeful and then, sit down and cross our legs and then fold our arms. We still have a lot to do. I mean, we obviously need to protect our health and social care workers, not just protecting their well-being. We need to take good care of their mental health as well. I mean, yesterday being World Mental Health Day, is no better time to re-echo this point. A message I got from last Thursday's session was that to do well, you need to be well. So to get the best out of our health and social care workers, we need to ensure that they are in the right frame of mind. And we need to put the adequate and appropriate infrastructure in place to protect our health and social care workers. We obviously need to have a lot of investment. We need governments to ensure safe and decent working conditions. We need to invest in training and education. We have quite some gap to bridge when it comes to the health professional to population ratio. And we need to invest a lot more into scientific and medical research. We have our role to play as well, and that is the together elements. As health and social care workers, we need to engage a lot more in public. We need to engage a lot more with the public and, engage in public education as well. With this, I believe we need to adopt a preventive approach. We need to educate the public on the need to complete their antimicrobial, regimens. We need to educate them on the need to engage in regular exercises. This in itself is going to go a long way to reduce the workload that eventually comes onto us. We certainly need to promote health partnerships. I can't re-emphasize that point any further. We need to encourage collaborations and transfer learning, because the goal at the end of the day is universal health coverage, and we can only do that by all working together. So my concluding remarks, I certainly believe no country is isolated. We are all interconnected. All it takes is for one individual to cross your border. But certainly every country needs to build local capacity, because at the end of the day, when push comes to shove, it's what you can do within your country that is going to get you across. That's a wonderful picture of some of the members of our health partnership, both UK and local. Thank you very much.
Cornelius, thank you so much. And what a lovely photograph that is. Thank you. Thank you for also, it was a deliberate choice, but you focused on the silent pandemic of antimicrobial stewardship. It's a really sobering reminder, isn't it? That even as we drag ourselves out of this current pandemic, the next one is around us and about to happen.
Absolutely.
So all your points about the need for solidarity and skills exchange, the need to recognize the mental health dimensions, but also I particularly liked the examples of innovation you gave. Lots of learning which we must seize hold of and use in the future. So now we're moving from Ghana and the continent of Africa to Dr. Kem Pokhrel, who joins us from Nepal. Kem is a global health professional and the country director for FET in Nepal. Kem, I hope you're here. The floor is yours. I can see you, which gives me hope, but you're not yet unmuted and speaking. Okay, Kem. In which case, we might jump past Kem to Dr. Emma Mitchell. Emma, I hope this isn't too much of a shock to suddenly put the spotlight on you. Emma is a geriatrician based in the UK, and a lot of us have been admiring her for many reasons, but including her work in support of Myanmar and colleagues there at this difficult time. Emma, thank you for jumping up and joining us today.
Good morning. That's no problem at all. So it's a great pleasure to be here today, and I'd like to share my thanks to Ben and the team at FET for giving me this opportunity. My name is Emma Mitchell. I'm a geriatrician working in Bristol, which is in the south of the UK, and I'm just trying to share my screen. Let's see if we can do it. I might need to go back into 2 ticks. Let's try again. Oh, it sounds like Ken might have come back. Let's try again. There we go. You'd think we'd be slick at this by now, wouldn't you? Okay. Okay, so yes, I'd like to share my postcard of hope from the UK, and this will be through my lens, through the experiences that I've had so far in my career in global health, but with particular emphasis on the activities that I've been involved with in Myanmar. So here is a timeline demonstrating my journey into global health thus far. And of most importance really was my fellowship as an Improving Global Health Fellow based in Yangon, Myanmar, which was between 2016 and 17. This really was a catalyst for the activities and opportunities that happened thereafter. For example, I've been faculty member for an education course supporting doctors in Myanmar in postgraduate examinations, and I've also been involved in running a research project looking at the ageing population in Yangon. So what have my experiences been since the pandemic? Well, I think I speak for many when I say that sometimes the road has seemed rather more uphill than perhaps it used to be. It's been a little bit more uncertain, and the endpoints with some of our activities have perhaps been a little bit less clear. There's been a huge shift in the way that we've been working and the things that we've been able to do, not least because of restrictions to international travel, but also because of changes to the funding streams. However, whilst a lot has been challenging, there have been many opportunities and examples of how we've been able to work within our healthcare partnerships in different but very innovative ways. The situation in Myanmar since the pandemic has been challenging for numerous reasons. Myanmar identified its first case of laboratory-confirmed COVID-19 in March 2020. Even prior to COVID, the healthcare system was stretched and it was challenged. There were just 6.7 doctors per 10,000 of the population versus the global average of 15.6. Nevertheless, there were hugely proactive demonstrations led by the government to try and combat COVID-19, including many effective public health campaigns to try and raise community awareness and to keep people as safe as possible. However, things really spiraled downwards in February of this year when the military coup occurred. In response to this, civil servants working across various different employment sectors started pursuing the civil disobedience movement in protest. And healthcare workers, and particularly doctors, were at the fore of this civil disobedience movement. As such, healthcare professionals became targets, and there have been more than 250 accounts of violence against healthcare professionals, facilities, and transports. There has been decimation and near collapse of healthcare infrastructure and administration, and healthcare professionals are having to work in completely different ways to try and meet the needs of the population. Patients are often preferentially wishing to be treated at home because of fear to access healthcare facilities. There are severe barriers to access to basic medications and oxygens to treat COVID-19 infection. Examples of the challenges that have been experienced have been exposed across a wide variety of media and by a wide variety of authors, including this article by Lord Darcy in the BMJ. So what have we been doing since the coup? And I say we because I'm one of more than 30 healthcare partners who have joined together to support colleagues in Myanmar since the coup occurred. This collaborative effort has led to a really rather impressive response with a wide range of activities, including the creation of educational resources, various advocacy events, and we've also organised fundraising events. But perhaps the activity that I've been closest to and I'm certainly most proud of has been around supporting more than 180 doctors from Myanmar with their visas and jobs in the NHS. Through our network a few months ago, we became aware that there was a sizable group of doctors from Myanmar who were in the UK trying to get GMC registration. These doctors were facing pressing concerns with regards to their visas that were due to expire, and they were facing the decision as to whether they would have to return to Myanmar and face personal security threats or need to request asylum in the UK. This is a group of young, motivated doctors who were merely trying to progress their clinical careers. Through our networks, we reached out to organisations including the Department of Health and Social Care, and became aware of a scheme called the Medical Support Worker Programme, which is being led by NHS England and NHS Improvement. This collaborative effort has meant that we've been able to secure jobs for all of these doctors and secure safe visas for them to legitimately remain in the UK and progress their clinical careers. And we've recruited now to 7 hospitals across the south of England. Throughout all of these activities, a question that has cropped up constantly to me has been, how do we continue to strengthen our international health partnerships despite the challenges that we have been facing? First of all, communication. It's been the maintenance of good communication both within and between our healthcare partnerships that has been vitally important. Activities and experiences shared can be translated into other health settings. It's been important to maintain the strength of connection between colleagues, and it was through perhaps these more informal channels that I became aware of the large group of doctors from Myanmar who were in the UK. It has been important to keep an open mind and be flexible to the changing landscape we have found ourselves, and I think I can talk for many when I say that I've been involved with rather unexpected activities since the pandemic. And lastly, commitment. The last 18 months have demonstrated how our commitment to our healthcare partnerships is key, and that despite the challenges, it has continued to be incredibly inspiring, motivating, and empowering. I'd like to finish with some of my hopes for the future. In the future, I hope that we will be able to restart and develop post-COVID academic activities that will remain to be incredibly important. My interest is in ageing populations, and this is one that has been disproportionately affected by the COVID-19 pandemic. Linked with this is the continued collaboration with the UK Health Partnership. Whilst the situation in Myanmar has been incredibly shocking, the strength of collaboration and support for one another through the UK Health Partnership community has supported one another's morale and our positivity to keep going and do what we can to preserve the gains to healthcare from our previous year's work, but will also, I'm sure, provide a solid platform to help us respond to the current and future health priorities to help improve the situation in Myanmar. Thank you very much for listening.
Emma, thanks so much. Of course, what you don't really make clear is that you do that all on top of your day job. So it's wonderful to have you focus on the Myanmar work, but I do sort of want to acknowledge you have a day job as well, don't you?
That's correct, yes.
Which takes considerable energy. And thank you for managing to stay optimistic and hopeful. I think because I'm part of this as well, so I too have witnessed the strength of those friendships, of those professional relationships, and how strong they are and how they've sustained even during this difficult time. Also, you've been particularly brilliant at organising the absorption of doctors into the NHS, as you highlighted. I would like to sort of praise the Department of Health and Social Care in England, because they've been great partners to us on that, haven't they? And eased the way for people who otherwise might risk being deported out of the UK back to Myanmar, which is a kind of intolerable, sort of, you know, intolerable thought, really. Thank you so much, Emma. We will have time for Q&A, at least so I hope. So do start posting questions, but I'm going to make one last effort to go to Kem in Nepal. Kem, are you there? You can't have a second introduction from me, but I'm hoping that you'll be able to connect. It was such a shame. We were in contact, weren't we, earlier this morning? Something's happening. So we can't hear you, even though we can see that you're trying to present slides, which we can see. So I think my advice, Kem, is to keep trying, but we'll move to some questions in the meantime. Elizabeth, I hope you're still with us, and that you've been able to see the chat box, because the chat is full of praise for your speech, which is lovely. And also there's a question from Louise, which is about what more can be done to encourage the appointment of chief nursing officers? Could I ask you that, Elizabeth?
Yes, no, thank you, Ben, and thank you for the question. I think I just want to perhaps as a way forward in answering this question is, as a part of the resolution that was passed at the World Health Assembly recently, there was also a call to support, the senior leadership in countries. So I think, alongside with the options for leadership policy within the strategic direction for nursing and midwifery, as well as the resolution on nursing leadership, I think countries can move forward knowing that they have had a resolution supported or endorsed by their ministers of health. That's one way to really take forward that from a country level. I think from a global level, we have, WHO has also initiated a response to a request from government chief nursing and midwifery officers to establish a platform or a network where they can continue to actually communicate and network with colleagues across the world. They don't get this opportunity very often because I suppose, WHO hosts a biennial government chief nursing and midwifery officers meeting. But they find after that they're not really remaining connected. So, community of practice is being established. And we've had discussions with government chief nursing and midwifery officers, and also nurse leaders in countries that don't have these posts. And so, we will be encouraging our colleagues who are in this post, who have listened, who've done it very well. We're there at the top level in terms of communication and making changes in response to policy options, because they are directly responding to ministers of health to share their experiences and to support others who want to establish this post. So we've got a lot of work to do, but I feel that we are on a pathway to actually encourage governments and nursing leaders in countries to actually have this have a nursing and midwifery division, as well as to appoint these nurse leaders in posts.
Thank you so much. I should give a shout out, or I'd like to give a shout out to the Nursing Now Challenge, who are exhibitors at this conference. So during the break, do go and find them, engage with them. But I'm sure, Elizabeth, you welcome that continued energy around nursing, and I should say midwifery. I say that partly because Joy Kemp is, I know, part of the audience, and Joy, this is me correcting my earlier mistake. It's nurses and midwives that we are passionate about. Emma, you've got lots of praise from people. I hope you've been blushing and seeing the chat box, including some people. It's lovely Gideon is with us, and Dr. Gideon Lara, and reporting about the work he's been doing to support some Myanmar doctors entering NHS. We're having a session, aren't we, on November the 27th, I think it is, when we're bringing together the Myanmar diaspora in the UK. And we must get information to you about that. But there's a very specific question to you, Emma, which is, can you tell us a little more about the research you intend to carry out with you have and intend to carry out with your colleagues in Myanmar?
So the research that we were involved with pre-pandemic was effectively a needs assessment. It was a mixed method study to try and characterise the population of older people that were accessing hospital care, but then to gather qualitative information from healthcare professionals and from patients and their families surrounding what the needs of older people are when accessing hospital care, and what the existing services were in Yangon in order to help provide proposals for a strategy or prioritization in the shifts in way services could be developed. Now, of course, the situation has radically changed since then. So whilst I still think that that will be a priority agenda, we know older people are much more vulnerable to getting much more severe infection from COVID-19. There's inequity in access to hospital care, and so on. It's still going to be a priority area in terms of multimorbidity, chronic disease management, and so on. But I think drawing on some of the things that we've talked about previously in the conference as well, I think, we've certainly been working in different ways, and remote working has proven to be pretty productive by and large, and perhaps surprisingly so. But I think, involvement of our and working better with our diaspora networks in the UK as well, I think will be mutually beneficial for helping to design and get projects off the ground, and be as effective as possible. So I look forward to that opportunity.
And Emma, you should be referencing Experts in Our Midst, which was the report that THET produced recently, celebrating the expertise diaspora bring in global health. And those of you who missed it, there was a fantastic session on Friday. So go and find it and watch it. I seriously recommend it. Kem, I'm expecting you to sort of dive in at any moment. So if you do recover the internet, do join. But I have a radical proposal, which is that when you recover the internet connection, we'll record your contribution and we'll make it available to delegates. Dr. Dudu, there's lots of questions for you. There are particularly two, aren't there? One is around the mental health problems, and how you felt that was promoted, how well-being was promoted amongst healthcare workers. I think people are particularly interested in this because of the session we'll have later. Can you give further insight into that, please?
All right. So, during the pandemic, the main issue was the workload. The comorbidities that came along with COVID, and it was mainly the workload and stress. And it was in the heat of the pandemic. So everybody needed to get the act together to address it. But things have quietened down slightly and have become a little bit more relaxed. So I think people are getting back in shape. But during the heat of the moment, we needed to get things going.
That's a very calm response. People getting back in shape. That's great. I don't know. Is that your sense, Emma, Elizabeth? Are health workers getting back in shape, or actually are they questioning whether they should stay in the profession? And what's your perception of the challenge we face? Perhaps Elizabeth first.
Well, I think, I call this a very fragile situation because of, from a nursing and midwifery perspective, the burnout, because, as you said, Dr. Dudo, is the workload, the extreme hours, and so the stress of their personal and emotional stress around, how they're treated by neighbours, by families, by others. It all adds up to that stress level and burnout situation. I think, I always like to think, we have a resilient workforce. I think this is such a prolonged crisis that I think healthcare workers are really just tired, and some are actually opting to leave the profession. And I think that's why my message is about we really can't afford to lose those we have in the system. We need to be taking more care of them and recognize some of these signs and symptoms and be able to support them. I think there's been, quite a lot of programs, psychosocial, psychological support for colleagues that have been implemented, especially for this time. So I still think, yes, I think, being calm is great, but I think at the same time, I think, it is a fragile situation. And I think different people have different coping mechanisms. But I think overall, I think it's a crisis.
Emma, do you want to add to that before I ask Cornelius to come back?
Yeah, I think echo everything Elizabeth said, really. I think it's that attrition, isn't it? Because this has been so prolonged. And I think my UK NHS experience is such that I think similarly for nurses, healthcare support workers who spend prolonged, probably longer periods of time with patients than medics will do, putting themselves at risk, their families at risk. There's been flux up and down as COVID cases have surged and relaxed again. And I think the attrition of all of that has become tiring, even though there have been, a multitude of examples where, great leadership has been demonstrated. And I think similarly for GP colleagues, I think GP is a really hard time in the UK at the moment, with huge amounts of, catch up from, follow-up meetings and so on that would have routinely happened during usual times that have had to be postponed, delayed diagnoses, and just the sheer volume and risk-taking that comes with the sort of telephone consultation style and so on. And then thinking about the group of doctors from Myanmar that I've been supporting, there's been a large number of, really heart-wrenching stories of them losing family members, friends and colleagues as a direct consequence of COVID, but then also because of the political situation as well. And I think that turmoil, as well as the professional stresses that we've just talked about, are and will continue to be, as Elizabeth says, a crisis, really, I think, for at least the near future.
Your comments about general practice got 7 love hearts, which makes me think there are a few GPs in the audience. Cornelius, you deserve the right to reply.
With regards to the stress levels or the other question that has to do with?
Yes, I don't know whether you're coping better in Ghana than we are in the UK.
No, I mean, during the heat, less contact with families in itself contributing to stress. But now things have relaxed a bit. We can have a little bit more time with families. So I think that in itself puts you in the right frame of mind to carry on with your work. Yeah.
And the inquiry that FET is doing at the moment with my colleague Lisa Kelly leading from our side, and it's being chaired by Sir David Nicholson, who's former Chief Executive of the NHS in England, kind of wants to ask the question, to what extent does working across borders and the solidarity and expressing solidarity, sharing expertise across borders, to what extent does that contribute to well-being? In some ways, it sort of seems obvious that it would. It helps us see our work in context, doesn't it, and compare notes, etc. But that's very much the focus of our inquiry, and you can join sessions for that. May I ask you, Cornelius, this other question, which is about curbing AMR and this silent pandemic that we talked about. Here's a very specific question for you.
Yes, I believe things haven't really changed to what we can do to curb AMR even during the pandemic. I believe the key thing we need to do is still to continue to comply with antibiotics therapy. I mean, there's no point stopping your therapy 2 or 3 days down the line when you've got a 5-day regimen. When you start feeling better, I mean, the resistance once these bugs get resistant, it becomes very tricky, and you need a longer time to treat them. So I believe compliance is very key, and education along the lines of compliance as well. I mean, we continue to engage the public, and the point about certain sanitizers containing antibacterial agents. Given the chance, when I've got a sanitizer and a hand wash basin, I would always wash my hands. I would always go for hand wash as compared to the use of sanitizers, because I feel that is I prefer that to the sanitizers, and in my head I know that I've gotten rid of a lot more bugs as compared to the sanitizers. So I would always go for hand wash over sanitizers that may contain antibacterial agents.
There's one question about are health workers prioritized in terms of getting access to vaccination? I suppose the answer is yes, is it?
Yep.
But in the context of those opening figures, that whereas in the UK we have 80% coverage, we were hearing that in Ethiopia it's less than 3%. So it's in that context, health and social care workers are being prioritized. But I suppose we can also ask, who is a health and social care worker in a pandemic, in the pandemic of AMR or in the pandemic of climate crisis? And it's just, I suppose, a reminder of how vital it is that everyone gets access to vaccination, including the person who cleans the establishment. Elizabeth, there's another question from Kerry Jones. Perhaps this could be the final one, and you could then, any final comments you'd like to make about the hope in the International Year of the Health and Social Care Worker. But this is from Kerry Jones. At least half of mortality and morbidity is due to systems failure. Would you agree that all clinical courses should include basic training in system improvement science and leadership skills?
Thanks for the question, Kerry. I think this is a really important aspect that you don't normally kind of get in your undergrad training, but I think it's a quality improvement aspect of any work is really important. And of course, I think these should be some of those sessions as a continuing professional development aspect should be a must-have, especially for our leaders. So leaders are across all levels of an organisation. I think it just kind of built on actually strengthening health systems. So yes, I would agree that this is something that's really important to be had, just as important as the leadership training, which you don't kind of always have that within your undergrad development, undergrad programs. But I think as you graduate, as you move on through through your levels of work, it becomes very critical to have these skills. And I think so when you're in those positions at the top level, that I think decisions are very comprehensive in terms of how you come about formulating those. So I agree. I think it's very, very important.
Great. And any final comments anyone would like to make? We're in the last minute of the presentation. Maybe Emma, I go to you, and then Cornelius, and then finish with Elizabeth.
I'm not sure what else to add, really, Ben. I think, this has been a really fruitful conversation, and it's been great to sort of share our sort of vision going forward and the hopes for the future, because, as we've discussed, yes, COVID is a priority area at the moment, but there are lots of other things in our pre-existing activities that must and should carry on as part of our recovery from all of this. And that's where, our healthcare partnerships and the ways that we work with one another are going to stand the test of time in trying to help to rebuild and strategize for those things as we start to recover from the pandemic.
Thank you. Cornelius.
Yes, I certainly believe we still need to continue to engage the public. Let's not stop our public engagement in education. That in itself is going to go a long way to reduce the workload that comes onto us. We need to continue to hope that health partnerships are still going to receive some more funding that will continue our work. And then, as I indicated, no country is isolated. We are all interconnected. But we also need to, promote and develop local capacity within each country. Thank you.
Thank you. Elizabeth.
I think for me, the critical element going forward is that we must continue to work as a multidisciplined way. I think, building it at national level and also at the global level. So partnerships and collaborations remain very, very important, for countries, for our individual health and care workers, and for building back, a stronger and resilient health system. I think it's really important that we harness all of that knowledge and expertise going forward, and we'll come through this with a more positive future.
Thank you so much, and thank you, all of you. And if I may say, I find each of you inspiring. So thank you for the work you do. Thank you for creating the spaces to talk across borders and express solidarity with each other. I think you're wonderful. I think you are representative of a very large community of people. As Dr. Tedesse said in her presentation, in some ways, health and social care workers are much better at expressing solidarity, the solidarity that we urgently need in this International Year of the Health and Social Care Worker. I think you all live and walk the talk, as do so many other people in this conference. Thank you very much for your time and making yourself available. Bye.
Bye-bye.
Thank you, Ben.